Part three of our discussion about mental health care and financing mental health care system will shift from talking about finances at the system level to talking a little bit more about finances at the counselor's level. So how you actually deal with billing and the ways that you will interact with money as a independent counselor. And this idea of talking about money as a counselor is a bit of a shift from the role that you usually have. And this quote is old, so the language is old in that it uses terms like psychotherapy, therapist, and patient. But if you can replace those with counseling, counselor, and client, then I think you will still get the same message. But the quote says that monetary discussions in psychotherapy are unique because the focus is on the therapist's agenda rather than the patient's needs. So a lot of times as counselors, we know that we are there to meet the needs of the client, but getting paid is a need of the counselor. We're not volunteers, we're not providing these services for free typically, and so we need to be able to have frank discussions with our clients and communicate with them about what your services are worth and how to pay you. And that it means paying for office visits, paying for home visits, but it also means paying for other types of services that we'll talk about later in the PowerPoint. If you're thinking about opening a private practice, it's important to consider some of the costs that will come up, and the first could be salaries for anybody that you have on staff. You might end up employing other counselors in your private practice, and you will need to determine if you will pay them as contract workers or pay them for the services that are rendered, or if you will actually provide them with a salary. And there's different advantages to setting it up in different ways. But you'll also be paying for the facilities for your rent. You might decide to purchase a building and have some investment in the actual structure and land that the building sits on, or you might just rent out some office space from another practice, from a medical practice, or from an office building community. Within your office, you're going to need to have waiting room furniture, you're going to need to have your desk space, and then you're also going to need to have your furniture in your office where you actually work with your clients. And then you think about who your clients are going to be and how the furniture can meet those needs. So if you're working with couples, are you going to have a couch that the couples can sit on together? Are you going to provide different types of seating in case couples don't want to sit on a couch together? If you have children, will you have small furniture suitable for young children? Will you have play therapy tables, sand trays, and things like that? You also might have office equipment such as Xerox machines, just down to computers and staplers and telephones and fax machines and so forth. Will you be providing any kind of professional development for your staff as new reform initiatives come down from the state level? How will you help train and prepare your staff to be able to incorporate the new procedures as they come up, or new treatment protocols, or for example, when the DSM-5 eventually goes to a DSM-6, or we all switch over to using ICD codes only, how will you prepare your staff for those? And so will you need to reserve some money for professional development and going to conferences and things? You need to decide if you will be hiring a bookkeeper who will process your appointments and any kind of letters and paperwork that need to be sent out, or will you be doing those things yourself if it's a smaller private practice? And then your overall accounting. You'll be needing to prepare taxes for your business, and will you keep track of those things on your own? I would not advise that you do. I would advise that you hire someone who will do your accounting. Sometimes your bookkeeper can also be the person who files your medical claims to different insurance companies. You'll also always need to maintain a liability insurance coverage no matter where you work, and sometimes from time to time you may want to hire a consultant. It's usually a good investment to hire a consultant at the beginning stages of a private practice so that you can get off on the right foot and maximize your investment early on. And when you think about setting your fee for how much you will charge. You can look at the ACA Code of Ethics and see that you are directed to determine what the community standard is for other similar types of providers in the community. If you move to a new area or you're setting up private practice for the first time, you'll want to look at, well, what are other counselors charging in this area? And typically that range is somewhere from $50 to $150 depending on the geographic region. The cost of living in the community where UNC Pembroke is much lower than it is in, say, for example, San Francisco. So your fee that you charge as a counselor is going to have a relationship to the cost of living in a particular community. Other things that you'll want to think about is that if you find yourself working for an agency that engages in unethical financial practices, you have an ethical responsibility to attempt to change that situation or leave that situation. If you are at an agency and they are billing for clients that are deceased or billing for services that they're not actually provided and you find out about it, you have an ethical obligation to try to get them to stop, to correct that situation, or you need to leave that situation. You're putting your own license and your own professional reputation in jeopardy if you continue to work for an agency that is not engaging in up and up ethical financial practices. So when you do spend time in a session, whether that be an intake interview, a couples counseling session, a play therapy session, or a individual one-on-one traditional outpatient session, then you're going to charge your third-party payers like insurance companies with using CPT codes that represent the length of time of your session. So here are some examples of, you might have a brief session that goes somewhere between 16 to 37 minutes and you're going to use then this code, for example. Or you might have a longer session that goes from 38 to 52 minutes. That would be the more traditional session. Or you could have one that was even longer that goes beyond 52 minutes. You also want to think about how you will charge for consultations, crisis response, report writing that you do on behalf of clients, such as in child custody situations, and also when clients request copies of their records. There's something that you would also be wanting to charge for. There are resources available for you. You don't have to figure all this stuff out on your own. There are a lot of books available about how to run a private practice, but there are also some great YouTube videos, and here's a link to one of them that you can watch on your own time that will help you to figure out about setting up your private practice. Accepting payment from clients, you'll need to make some decisions there. If you would like to get on insurance panels, then there's some guidance on a link here as to how to go about doing that. And what this means is that if you're a private practice counselor and you would like to start receiving payment from Blue Cross Blue Shield, you can't just accept Jane Doe to come in and work with you and she gives you her card for Blue Cross Blue Shield and then you tell Blue Cross Blue Shield they need to pay you. You actually have to in advance get set up to be someone that is credentialed by Blue Cross Blue Shield. You have to become an approved provider in their network before you could ever take Jane Doe's insurance card and file a claim with Blue Cross Blue Shield on her behalf. So that's a little bit of a lengthy process. It can be a little bit complicated. The insurance companies are very detail oriented, and so you really want to make sure that if this is the route that you're going to go, that you spend a lot of time on the front end being very thoughtful and detail oriented about how you go about getting on insurance panels so that you can get on there as efficiently and quickly as possible and start getting paid. Some people use a sliding fee scale, meaning clients are charged different rates depending on their life circumstances and their income or their salaries of the clients themselves. This is kind of an ethical slippery slope, and if you click on the link here, you can read a little bit more about what the downside of using a sliding fee scale is. Some counselors work in places where they have a salaried position, and that would be like a college counseling center, some agencies, and some private practices will hire a salaried counselor to work with them. So you get paid the same every year. If you one week you might work 40 hours, the next week you might work 42 hours that week, but you're getting the same salary no matter what. If you have 5 clients show up one day and the next day you have 8 clients show up, you're still getting the same salary. Contract positions would be more specifically written to fulfill a, a certain type of need or a certain set number of services that you would provide. And then fee for service would be that you maybe pay into a private practice group, and yet you only get paid every time you actually see a client. And the private practice gets a percentage of the money that you bring in. So we go back to the example of Jane Doe. So say I work in an ABC private practice group and I bring on Jane Doe and she pays me $100. Well, I might have to pay $10 to ABC private practice as being one of their private practice members, because I get the benefit of being a part of a larger group and all of the benefits that that provides to me. And then I would get paid that $90. But if Jane Doe misses her appointment, then I don't get paid at all. Then you have other clients who will pay you directly out of pocket and choose not to use Medicaid or a private insurance. And then finally, a lot of mental health care being paid for by Medicare and Medicaid, as we've discussed in previous slides. Now, counselors are still fighting to be recognized as providers by Medicare. It's important to note that psychologists and social workers were only added in the 1980s. Counseling is a much younger profession. We're really coming into our own in the 2000s, 2015, where we are right now. And so we're still pushing legislation through to gain recognition and to be able to bill Medicare. But counselors are definitely able to bill Medicaid. When you are working with clients and charging fees, it's really important that everyone knows ahead of time exactly what those fees will be, what will happen if an insurance runs out but treatment is still needed. It's important to discuss all these things up front and to go over them in your informed consent. So a lot of transparency around payment. In summary, private practice, you need to be thoughtful about the types of expenses that you'll incur as a private practitioner, but it's a great way to earn a living as a counselor. You get a lot of autonomy in your schedule. It is running a business, but it can be very lucrative for you if you're willing to put in the time and the energy and the enthusiasm to get it started and to get it running off the ground. So this can be a great way to earn a very, very good living. As far as what your salary might be when you're right out of graduate school, you're not going to immediately go into private practice. You're more likely to spend a couple of years as an LPCA working in an agency that primarily bills Medicaid, and you're probably going to have a salary right around in the 40s, around $40,000 as an annual salary working in an agency that bills a lot of Medicaid during your early years of practice, but the potential for that to go up if you were to perhaps work in a college counseling center one day or to open your own private practice. So lots to think about related to finances. It can be a little bit overwhelming. Not all counselors tend to be money people, but please think about money and please make sure that you advocate to get paid what you're worth, because you are worth a whole lot. The work that you do is very, very important. You're in business and you're running a business and you're providing a service, and you deserve to get paid. So there's never any need to feel bad about charging for counseling services. People are expecting to pay you for the good work that you're doing.